This is Sid, and today he will make a decision about his health. It's just a checkup, Sid. Go ahead, read a magazine.
Tongue, Mr. Grimm?
Why do doctors do all this stuff? What are they really looking for?
One thing, Sid. Most men your age often get a test for prostate cancer. This involves both a rectal exam and checking your blood, okay?
Sure thing, Doc.
I need you to lean down, put your hands on the table for me. I'm gonna check your prostate.
I have to do what?
You need to ask the doctor why he wants to do this exam. Now in a moment, he's going to order a blood test. How reliable is it? What are the risk factors? And what does it mean if the blood tests are positive? I guess you should have asked this before the exam started, but you can still make a choice about the blood test.
So what are the chances I have cancer, Doc?
That depends. I'm gonna take a blood test as a routine test for cancer.
Medical tests should only be done if the benefits of testing outweigh the risks. Does Sid know better than his doc what the risks are? The mild form of prostate cancer is common, especially amongst older men. And men with the mild form will probably never know there are any problems with their prostate at all, unless they have this test. And it is rare for men to have the dangerous form of prostate cancer.
So that's good.
There's a catch.
The Prostate Specific Antigen, or PSA blood test, does not let the doctor know whether the cancer is mild or dangerous. And most positive screening tests are falsely positive, or detect the mild form. And again, even if you have the mild form, nothing bad could happen to you for the rest of your life.
I'm gonna take some blood now for the test.
So you mean even if you take the blood test and it comes up positive, you really wouldn't know how bad I have it, would you?
That's when we have to think about a biopsy.
Blood tests which have a positive result for the mild form are often followed up by a biopsy of the prostate. Biopsies, which remove a few cells believed to be cancerous, are not risk-free. They can lead to bleeding, infection, and inflict a great deal of psychological distress. Even when multiple biopsies are obtained, most men are not found to have prostate cancer, either mild or dangerous.
But some men do have the dangerous form of cancer. And most men, when they know they've got any kind of cancer, they want it out. Gone. How about you, Sid?
I mean, who wants to have cancer when you can be cured?
Sure. 28,000 men died of prostate cancer in the United States in 2011.
That seems like a lot of guys.
This is about 1 in 10 of all men who underwent a biopsy and were diagnosed with cancer. That means that 90% were in danger of side effects for no apparent benefit.
Yes?
It seems like the complications could be severe.
Prostate surgery can be complicated by permanent incontinence or impotency. In rare cases, it can lead to bleeding or infection, and in very rare cases, death.
Geez, how do we tell our patients to make that choice?
You really want me to think about this for myself?
While prostate cancer screening can sometimes detect a dangerous form of cancer and prolong a man's life, it is more likely to lead to lifelong disability than a cancer cure.
Disability?
Here's the deal, Sid. While prostate cancer screening can end up saving a man's life, it can also lead to problems with urination and sexual performance.
That's the choice I have to make?
It's a difficult choice that many men will eventually have to make. Even me. I'm glad you asked.
A patient-doctor relationship is a partnership. Many doctors order tests that are not recommended without discussing them with the patient. Here are a few of the questions you should ask before any medical tests are ordered.
What tests are you doing today? Why are these tests being done? And what are the officially recommended tests for healthy men my age? Are there any dangers or side effects to treatment if the test is positive? And what will we know after the test?
When the results are ready, make sure the doctor tells you what they are and explains what they mean.
So, I'm going to want the test results sent to my primary doctor.
It's your health. It's your body. You decide.
Thanks for listening.